Hi, good morning, everyone. Thank you for joining us for this Facebook Live for Sexual Assault Awareness Month. My name is Sarah Jennings, and I'm the manager for Bon Secours Richmond Forensic Nursing Services.
Good morning. I'm Bonnie Price. I have the pleasure of being the director of the Forensic Nursing Program, as well as the Human Trafficking Initiatives for Bon Secours Richmond.
We wanted to talk this morning about our program. We're actually celebrating our 25th anniversary, so I'm going to turn it over to Bonnie so she can give you a little history about the program.
We are very excited about the fact that we have made it 25 years. The program started in November of 1993, and we had one patient the first year, and last year we had over 2,300 patients. So each year we've grown. We started with 3 nurses, myself and 2 other nurses from the emergency department here. And we saw a brochure one day about how to collect evidence better in cases of sexual assault. We thought it was interesting. Little did we know that, or little did I know, that would be the start of my career as a forensic nurse. So from the 3 on-call nurses that we had, we're now up to 12,
almost 13
full-time forensic nurses. And we're one of the few forensic programs in the country that has a forensic nurse on duty. Nurses aren't called from home and don't work other jobs. They strictly work as forensic nurses, so they're much more available to respond.
So we actually cover all of Bon Secours Richmond. So we travel to all of the other Bon Secours facilities. Our home base is here at St. Mary's Hospital, but we see patients at all of the facilities. Our forensic patients are very varying. We take care of all different types of victims of violence, from sexual assault, physical assault, domestic violence, interpersonal violence. About 40% of our patient population is pediatrics. We also care for victims of human trafficking, workplace violence, and we also take care of suspects of crime.
The program does stay very busy. In addition to seeing patients, we also do quite a bit of community education and presentations to community groups on the various topics. So we're very happy to have you join us on this Facebook Day.
We'd love to have any questions that you have. We'll be happy to answer them, tell you more about our program. All of our nurses here are very engaged in what we do. They also help with a lot of the community education that Bonnie spoke about. We're speaking with local law enforcement, Commonwealth attorneys, firefighters, EMS providers about how to better care for victims of domestic violence, sexual assault, strangulation, and how to properly take care of those patients.
We're also very fortunate that we get to participate in our professional organizations. In fact, Sarah is going to be the upcoming president of our International Association of Forensic Nurses. Sarah, why don't you tell them a little bit about forensic nursing in Virginia? How many programs are there?
Sure. So we have about 13 to 14 forensic programs in the state. Some of them vary. Some just see pediatrics. Some see both adult and pediatrics. We have about 70 forensic nurses in the state, and we meet about every 1 or 2 months as a group to talk about what issues are happening in the state, how from a legislative perspective can we better care for victims of violence. So I've had the privilege to serve on that board for numerous years. And we also have 2 of our current staff. Megan Pond serves as the chapter secretary, and Angela Maudlin serves as our chapter treasurer. So we stay very active in that group to help advance the career of forensic nursing, make it more aware in the community, because one of the things we want to do is bring awareness to every hospital that there is a need for forensic nurses within their facility.
Absolutely. Access to care is something that Sarah and I talk about frequently, how we can get more forensic nurses across the state as well as across the country so that when patients have needs, they can come. And I think it's important, since this is sexual assault awareness, for everyone to know that if you have someone that you know that reports that they have been a victim of sexual assault or physical assault or domestic violence, please come to the hospital. There are nurses here that can help you. We're specially trained to collect evidence, to document the injuries. We take photographs of any of the injuries, and then we testify in court as expert witnesses.
Absolutely. And while you're here at the hospital, we're providing both medical care and the forensic component. So we're making sure that there's not other things going on that could make the actual assault worse or different. And we're giving medications to treat for potential sexually transmitted diseases.
The other thing that's really good is we have a program called Our Heart. You want to tell them about
Sure.
that?
So Our Heart stands for the Regional Hospital Accompaniment Response Team. And we have a group of advocates that are volunteers that come into the hospital, and they're here with every patient that's 13 or older that has experienced either some type of interpersonal violence or sexual assault. And they stay with the patient throughout the whole entire process, providing resources such as counseling, emotional support. If they need resources once they leave the hospital, they're able to help identify those needs and meet those needs.
Absolutely, and I think it's important that that we have that type of program. The forensic nurse often has to focus on the evidence collection and the scientific process, but there's always somebody here to provide that emotional support that they need, and they follow up afterwards.
Absolutely. Something unique to our program, we participate in multiple different sexual assault response teams, or SARTs, in the area. So we are always working jointly and collaboratively with both local law enforcement, the advocates and victim witness personnel in the area, Commonwealth attorneys, and then the forensic nurse. And we come together as a team to better care for these victims.
We do, and all of the jurisdictions locally, but I think it might surprise some people to know that we serve 26 different counties, cities, towns across the state of Virginia. Some of the patients are up to 2 hours away that come to see us, and that goes back to the access of forensic nursing care is not everywhere in the state. So law enforcement and victim witness and Commonwealth attorneys make that trip because they know it's so important for the patient to have a forensic nurse.
Something that's unique about us, all of our forensic nurses, most of them historically have been prior emergency room nurses, so they have really great critical thinking and some very good experience with assessment. But they've all received specialized training on how to be a forensic nurse. They've completed a certain number of clinical requirements, and then about 9 of our nurses currently are certified as a sexual assault nurse examiner adult, so a SANE A, and also a sexual assault nurse examiner P for pediatric. And that's something that we find that is a plus for our team. We are specially trained. We also have the certification that's nationally recognized.
And all of those things help us to testify objectively as expert witnesses in court. Frequently we're asked, how often do the nurses go to court? What would you say?
It depends on which nurse, but a couple times a year for the most part.
Yeah. I think last year we received over 100 subpoenas. So requests for court, that's for the entire team. So we spend a fair amount of time going to court. I think the other question that we're frequently asked is, how do I become a forensic nurse? Let's talk about that.
Sure. So that is a really popular question, actually. And most of our nurses, like I said, prior ER nurses, a lot of them have been in some type of critical care setting. So that's something that we find that's very helpful. A good critical thinking, good assessment background. But if you have an interest in becoming a forensic nurse, that would be where to start. We also like our nurses to have a minimum of a bachelor's degree.
Absolutely.
And at least about 2 years of experience as a registered nurse.
And our hope, well, let me rephrase that. My hope is that they'll go back to school, and Sarah's,
yes,
and get master's degrees and doctorate degrees. Because education is important to us. So the other thing I think that's important for people to know who might be thinking about becoming a forensic nurse is that there's a lot of research you can do out there on your own. The International Association of Forensic Nurses is a great place to start. We have a state chapter of forensic nurses, and there's various free trainings and conferences held across the country, and webinars that people could attend to learn more about what we do.
Absolutely. If you go to www.forensicnurses.org, that's our professional organization. That's a great place to start for some good information.
If patients come into St. Mary's to be treated, are they treated in the ER?
That's a great question. So if you didn't hear our friend that's with us, they asked if a patient presents to the hospital as a sexual assault, are they seen in the emergency department or somewhere else? Something that makes us very unique is our patients, for the most part, present through the emergency room. We do see some patients that are on the inpatient side, and we can talk more about that. But we actually have a suite that is a part of the hospital, but not connected to the main part of the hospital. That's a very quiet, private area where we have a interview room, a waiting room for our patients, and then we have our exam room. So we are taking the patient out of a very chaotic at times emergency department to give them as much privacy as possible. We're ensuring their safety throughout the whole entire visit. So there is a brief period of time that's spent in the emergency department, but the majority of the time is spent in our office suite.
And I think it's important for people to know the reason they're in the emergency department is to make sure any emergent medical needs are taken care of first. Medicine always takes priority over forensics. So if they have any injuries or need x-rays or CTs of their neck, say, for example, it's a patient who was strangled, those things need to be taken care of first. Yeah. So let's talk about strangulation.
Sure, it's great. So it was July of about 3 years ago.
I think so.
In Virginia, strangulation became a felony offense, and we knew that we needed to address our patient population because we were seeing more patients present to the hospital saying that they had either been choked, which is more of a layman's term, and strangled. So we developed a strangulation protocol for our facility, and we are screening all of our patients as either a victim of physical violence or sexual violence to see if they have been strangled. Something that is unique to our program is we actually collect potential DNA touch evidence from their neck. We are having them demonstrate how they were strangled with a mannequin head, and we're photographing that. And then we are releasing that potential DNA evidence to law enforcement for the purpose of their case.
And I think it's important for people who, again, might have friends or someone you know that says to you they've been choked or strangled, that even if they don't have external injuries, there's still sometimes injuries and symptoms that they can have. And it's really important that those things are documented so that there's a record of that when they go to court. Some examples of symptoms is difficulty swallowing, difficulty speaking, ringing in the ears.
Amnesia, forget what happened.
Some patients will tell us that they were incontinent, they had a loss of bowel or their bladder. And these things are really serious.
Mm-hmm. Absolutely. And it's very important that they seek medical care, and they can come to any of our Bon Secours facilities, tell the person at the ER that they were strangled, and they're going to also consult the forensic nurse in addition to taking care of those immediate medical needs.
Yeah. And not only do we do the initial exam, we also follow them up in about 3 days. And the reason we do that is because sometimes the symptoms don't show up right away. And some of the injuries don't show up right away. So you might see something we call petechiae, which are small red blood vessels on the face, eyes, or ears, mouth, and they might not show up immediately.
Several people have said hello in the comments.
Hi.
About fundraising.
I was going to say, let's talk about community support.
Yeah, absolutely. So something that's very unique to our program also is we rely heavily on community support. One of our largest fundraisers that we do each year is Wine, Women, and Shoes, which is held typically in the fall in Short Pump. You want to tell them a little bit about Wine, Women, and Shoes?
Sure. So the title of the event, I think, kind of tells you that it's meant to be a fun event to help raise funds. And so we have a committee, a Wine, Women, and Shoes committee that's made up of some of the most dynamic, wonderful people we've ever met.
Absolutely.
And then we have a group called Shoe Guys, and our Shoe Guys are fantastic. They're probably the best support team a forensic nurse could ask for. And the event is a chance for ladies and gentlemen to get together to learn more about forensic nursing, to visit some really fantastic vendors, sample wine. That's kind of the purpose of the event. the silent auction.
Lots of fun.
A
wine wall.
Each year they do a closet giveaway. I'd like to have that closet in my house. Yeah, it's a great event. And I think it's important for people to know that we are very blessed to work for Bon Secours, and Bon Secours has supported this program for 25 years. And so it's through Bon Secours and the community support that we're able to do the things that we do. Why don't you tell them about some of the things we've been able to do with the community support?
Absolutely. So, if we didn't have this community support, it would be very hard for us to care for these victims of violence. Something that in the last 2 years we were able to do is purchase a colposcope, which is a very large microscope that helps us identify injuries that we can't see with our naked eye, which is super helpful in a sexual assault exam. We can also see oral injury, and we were able to purchase that because of community dollars and support. Other things, or something as simple to others, but it's great to us, are gift cards. We receive gift cards to give to our patients, either for gas if they're trying to flee a domestic violence situation, or medication money that they may need, or just a gift card to a grocery store so that they can provide food for a family that they may not have been able to do before because of their situation that they're going through. On the other side of that, we're able to use some of those community donor dollars to help train our forensic nurses. Forensics is ever changing, and there's new things coming out each and every day, and we want our nurses to be the best trained possible. So we are sending them to conferences such as the Strangulation Institute. We've had several of our nurses attend that. The IFN conferences, our scientific assembly, to help learn what's going on in the forefront of forensic nursing across the entire country.
It changes rapidly, and we need to make sure that all of our staff stay on the front end of everything that's out there. I think the next big thing that Sarah and I would love to see with community commitment dollars is potentially expanding our space. We have a very cozy space now, and I think if we had a little bit more space, we might be able to serve a little bit more.
Our big goal is to have some type of training area. We do a ton of training, and we'd love to be able to do that here on site to make it a little bit easier for everybody.
Sure. I think one of the other new initiatives that we haven't spoken about much is maybe human trafficking.
Absolutely. Go ahead. You want to go ahead?
So several years ago, we were approached because one of the advocacy platforms of the Sisters of Bon Secours is human trafficking. And they knew that forensic nurses often took care of patients who were trafficked. And so Bon Secours Richmond and Bon Secours Health System put together a strategic quality plan of how we could address human trafficking. And we started with collaboratives and a task force. You want to tell them about those?
Sure. So we meet several times a year as a group sorry, our microphone is dropping. We have a regional law enforcement collaborative. So we're working with many different law enforcement jurisdictions and victim witness, including the FBI and Homeland Security. But the purpose that we're meeting is to come together as a collaborative to have an agreement of how we are going to better treat these patients of human trafficking, how to identify it, how to treat them, and then how to better serve them once they're identified. Another group we have is the Advocacy Collaborative. So it's a group of local advocacy resources such as Safe Harbor, Great Haven, Richmond Justice Initiative, Replenish Richmond, and Impact. And so we all get together to look at the advocacy side on how to better serve victims of human trafficking. Something that we feel very proud to say that we partnered with a year ago in January. We partnered with Safe Harbor to open the area's first human trafficking shelter. And then just recently we announced that we are partnering with them to do a transitional shelter for human trafficking. So once they've met some of their basic needs in the emergency human trafficking shelter, they'll be able to transition to the transitional shelter.
And both of those things have been really important.
Absolutely.
In our program over the last 2 years that we've been monitoring how many human trafficking patients that we've seen, we've had 110. I think it might surprise people to know that most of them are from this country. While some patients are foreign nationals, most of them are from America and are coerced into this really violent, evil lifestyle of being trafficked.
So once they're identified and they're brought to the hospital, the forensic nurse is responding and assessing the patient, meeting their basic medical needs. Some of these patients haven't had a meal in a very long time, or they haven't been provided proper nutrition, and they have a ton of medical needs that haven't ever been addressed. So we're helping to be the liaison between law enforcement and advocacy and the medical piece.
Absolutely. And I think it's important to know also that there's two kinds of trafficking. So there's commercial sexual exploitation as well as labor trafficking. Out of the 110 patients that we've had, the majority have been sexual trafficked. I don't think that's necessarily that it happens more. I think that that's just what's being investigated and found more. But people often say, we don't really have trafficking here, right? Mm-hmm. And the answer to that is we absolutely do. And I think if you never turn over the rock, you'll never see the issue. And it's not in one part of Central Virginia. It's really all over.
Absolutely.
In all of the counties that we serve, we've seen some trafficking.
Yeah. And it's very unique to Richmond because we have a lot of interstate traffic. So we see a lot of 95, 288, 295, and how trafficking victims are being trafficked using those major interstates in the area.
Absolutely.
Good. Anything else?
I think that's good.
I think that's covered everything. If you all have any questions, we're happy to sit tight for just a second. If you don't, we really appreciate you joining in. If you have any questions about forensic nursing, feel free to either reach out to Bonnie or myself. We would be happy to answer those. Help spread the word about forensic nurses, make them aware in your community that you have them, and please use them and tell your friends.
And thanks to everyone who supported us over the last 25 years. We couldn't have done this without you, our law enforcement, our attorneys. I don't want to forget anybody, our victim witness, forensic scientists,
Absolutely.
Our advocates, the people that work at the shelters. It's just been a team effort. The child advocacy centers we work with.
It truly takes a village.
It absolutely does. We thank you very much for everything.
Yes. Thank you.